With the first day of school less than a week away right here in Southern Nevada, the federal government announcing they are pulling the plug on some future vaccine development. Hello and thank you so much for joining us tonight live at 5. I'm Ebro Garcia.
And I'm Trisha Keene. Now those funding cuts were for mRNA technology, the same technology used to develop vaccines during the pandemic. Now, according to Health and Human Services Secretary Robert F. Kennedy Jr., the government will instead fund other vaccine platforms through a division known as BARDA. Kennedy says that they will instead be focusing on developing whole virus vaccines, which uses a different technology to battle viruses. However, many health experts warn future pandemics could be harder to stop without the help of mRNA.
They can be produced rapidly, they have saved millions of lives, and we are using them to do research on things like HIV and cancer and RSV and CMV and all kinds of other viruses, even the flu virus. So that this is going to leave us very vulnerable. This is potentially a dangerous decision, according to many health experts.
The HHS says some final stage contracts will continue, but no new mRNA projects will be initiated. And concerns are being raised here in Southern Nevada as fewer kindergartners are being vaccinated and more parents are opting for exemptions.
Tonight, I'm taking a closer look at what that means for our community and why health officials tell me we could be on the brink of outbreaks if the trend continues. Meet Kayla, a local mother who's making sure her children are vaccinated, and she hopes other parents do the same.
I feel that basically all kids should be vaccinated. I mean, if not, you're putting all other kids at risk of being sick.
But across the nation, the CDC is reporting fewer kindergartners are getting their shots, and the number of parents requesting exemptions is growing. I spoke with Dr. Roseanne Sugay, epidemiologist with the Health District. What are we seeing here in Southern Nevada?
So we're seeing the same thing in Southern Nevada. For the past few years, we have seen that slight decrease, sort of slow decrease in coverage in kindergarten and an increase in exemptions.
According to the CDC, Nevada's non-medical exemption rate for kindergartners rose to 6.7% this year, while medical exemptions fell to just 0.7%. With the rise in exemptions and with the decrease in the number of people who are getting vaccinated, could this lead to more outbreaks here in Southern Nevada?
That is always a worry we would have, obviously, is that more people would be susceptible to getting ill. And the more susceptible you are, the higher the possibility of an outbreak occurring.
Nevada requires most students to be vaccinated before going back to school, with boosters due before kindergarten and 7th grade. Medical and religious exemptions must be submitted on state-approved forms. Unvaccinated students can be kept out of school during outbreaks to protect others. Last week, I attended a media day for CCSD and met Cindy Flores with the Family Support Center.
You don't want to wait until the first day of school for the school to tell you, hey, you're missing vaccines and we can't get you started, right? So let's get those done during the summer.
And as for Kayla, what do you think needs to be done to help our students stay healthy and safe?
I think it just needs to be put into place. I know when I was younger, it was a mandatory thing to have vaccinations. My mom always took us. We couldn't go back to school unless we had a certain vaccination.
Now, if you still need to get your students their required immunizations, take a look at your screen right now. To make things easier for families, the Health District is offering special back-to-back school hours at the Henderson, Maine, and East Las Vegas Public Health Centers. We've listed upcoming dates and times as well as addresses. There are opportunities to 2 locations this Friday and another next Monday, but you must make an appointment. Just give the Health District a quick call.